Hi, I'm Joe Hacker. Not only am I a certified athletic trainer and certified strength conditioning specialist, but I'm also a student at the University of Cincinnati in the Masters in Medical Education program. I'm going to be presenting to you the clinical anatomy of the foot and ankle for athletic training in two parts. But what we're doing here is actually referred to as the flipped classroom model. Rather than going to class, listening to lecture, then going home, practicing the skills that you learn in class on your own, you're actually going to be viewing this lecture online as you're doing now. Then when you come to class, there'll be a short quiz showing that you were able to retain some of the knowledge you learned in this lecture. And then we're going to spend the remainder of the class in more of a lab type format where you're able to go more hands-on. Ultimately, each one of you have already had anatomy and physiology, so really this is a basic review for you, just a little sped up. What we're going to be going over in these two parts are the bony structures of the lower leg, ankle, and foot, the articulations, soft tissue, arteries and veins, and neurological innervations. When we refer to the lower leg, we refer to both the tibia and the fibula. Now there's a couple bony prominences to go ahead and be aware of. On the fibula, the most proximal bony prominence that we're going to be palpating is the fibular head, the most distal being the lateral malleolus. On the tibia, often we're going to palpate the tibial tuberosity, and distally, the medial malleolus. And looking at the ankle, we've labeled this A, B, C, and D. Now we've already identified A and B, those being the fibula and the tibia. Now, in looking at C, the heel, that's going to be the calcaneus, and D, the talus. These four bones make up what we often refer to as the ankle joint. Now pay attention to this slide. Things like this are going to be very good to know for that quiz. As we said, the ankle joint is made up of that tibia, the fibula, the talus. We often refer to this as the ankle mortise because it actually closely resembles a mortise and tenon joint used in carpentry. We've already identified the tibia, the fibula, the talus, and the calcaneus. We're going to go ahead and continue to move distally into the foot. Now we have the tarsal bones. These are the navicular, the cuboid, and the three cuneiforms. Continue on distally, we now have the metatarsals. In between the metatarsals and the tarsal bones, we have the tarsal metatarsal joints. Continue on distally from the metatarsals, we now have the phalanges, or the toes. In between the phalanges and the metatarsals, we have the metatarsal phalangeal joints. When we refer to the foot, we refer to it in three different zones. The first being the forefoot. The forefoot is made up of 14 phalanges, 5 metatarsals, and 2 sesamoid bones. We'll go over those 2 sesamoid bones a little later. Then, as we work more proximally, we have the midfoot, made up of those tarsal bones, the 3 cuneiforms, the navicular, and the cuboid. And finally, often referred to as the hindfoot or the rear foot, we have the talus and the calcaneus. Shown here, there's actually 3 different arches in the foot. Looking at A to B, that's going to be the anterior transverse arch. Going from B to C, the lateral longitudinal arch. And C to A, the medial longitudinal arch. Another great slide to remember for that quiz. Here's a little bit better view of the transverse metatarsal arch. The first view on the left is more at the tarsal bones. That's the cuboid, the lateral cuneiform, middle cuneiform, and medial cuneiform. Going further distally, we're still in that transverse metatarsal arch. We're actually more into the metatarsal bones, the 1st through 5th metatarsals, as shown here. We've already referred to the ankle as the ankle mortise, or the talocrural joint. Here is a lateral view of the ankle. There are 3 ligaments on this side that we need to be aware of. The first, the ATF, or anterior talofibular ligament, connecting the talus and the distal portion of the fibula, or that lateral malleoli. Next, we have the calcaneofibular ligament, connecting the calcaneus and the lateral malleoli. And finally, the posterior talofibular ligament, connecting that posterior portion of the lateral malleoli with the talus. Here's a medial view of that same joint. There's actually 4 ligaments on this side, often referred to as the deltoid ligament. The deltoid ligament is made up first of the anterior tibiotalar ligament, connecting the tibia and the talus. Next, we have the tibio-navicular ligament, connecting the navicular and the tibia. Going further, we have the tibiocalcaneal ligament, connecting the calcaneus with that medial malleoli. And finally, most posterior is the posterior tibiotalar ligament, connecting the talus and the tibia. Once again, these ligaments on the medial aspect often referred to as the deltoid ligament. When we refer to the ankle, not only are we referring to that talocrural or ankle mortise joint, but we're also talking about the subtalar joint, or some people refer to as the talocalcaneal joint. In addition to that, we also have the inferior tibiofibular joint. Now we're going to go over the syndesmosis, or distal tibiofibular articulation. This is the joint between the talus, the tibia, and the fibula. We need to be aware of this area because this is where it is injured during a high ankle sprain. The structure that's traditionally injured during this is the interosseous membrane. This interosseous membrane travels the length of the fibula and the tibia between the 2 bones. Other structures are the anterior tibiofibular ligament, the posterior inferior tibiofibular ligament, the transverse ligament, the posterior talofibular ligament, and the calcaneofibular ligament. The spring complex is actually a structure that is very, very vital in absorbing body weight and force. So we have here another medial view of the ankle. We've already identified each one of these subjects except for the plantar fascia, and we will get to that. Here, the 2 ligaments that make up the spring ligament complex are going to be the spring or calcaneonavicular ligament, which runs from the calcaneus to the navicular, and the plantar ligaments. At this point, if you have any questions at all, don't hesitate to email me in the email provided to you by your instructor. Thank you.